And Cheryl, thank you again so much for joining us today. We know that you are incredibly busy in this unprecedented time, but we appreciate you taking time out to talk to our business owners and help support them during this time of reopening. So thank you again.
Yeah, it's really a pleasure to be here. Thank you for having me. Los Altos means a lot to me. The success of the businesses mean a lot to me because I live there. I live in actually the county area, unincorporated area of Los Altos, but my kids go to school in Los Altos or frequent visitors to downtown. So I'm so pleased to be able to come and talk about our experience with COVID-19 and also to provide any support that you may need as we try to get back to some level of normalcy in our town. So I'm going to go ahead and get started. We've all seen this picture a little too often, I think, but this is what the coronavirus looks like. You've probably seen it so many times now in the media. And remember that corona refers to a crown, and those little red little points sticking off the virus are the crowns. And that's why we actually refer to this as the coronavirus. And there are other coronaviruses. You've probably read that as well. This happens to be the coronavirus that causes the disease that we've now named COVID-19. I wanted to talk just a little bit about sort of some symptoms that people experience when they do have COVID-19 compared to some other common conditions that we may see out in our communities with our family members, with friends. And so it's important to note that COVID-19 is common to have a fever. With a common cold, it's rare to have a fever. With the flu, it's common also. That's why the flu and in the beginning, COVID-19 were often confused with each other. And with allergies, sometimes there is a fever. There's common to have a dry cough, but with a common cold, usually the cough is mild. And with the flu, it's also common. Again, the confusion that happens between COVID-19 and the influenza. And then with allergies, sometimes there is a cough. Also very common with COVID-19 is shortness of breath. This real inability to catch your breath, always feeling like you can't quite get enough air. That's common. Not so much with the cold or the flu, or sometimes when you have allergies. Sometimes there's headaches with COVID-19. We've seen that. It's rare in the cold or with the flu. Aches and pains are sometimes present with COVID-19, but very common with the flu and a common cold. Not so much with allergies. And then fatigue sometimes happens, sometimes common cold, but common with the flu. Usually people are feeling very tired, and sometimes with allergies. With COVID-19, there's been some reports of diarrhea. It's rare. Not obviously with the common cold, sometimes with the flu. So with the runny nose, it's rare in COVID-19, but very common with the cold. And sometimes with the flu and with allergies, it's very common, obviously, and sneezing. Not so common with COVID-19, but obviously with the cold, and not so common with the flu. But with allergies, certainly very common. So you can see here why there could be confusion when people are having symptoms. I think the really, really important one is the cough, the dry cough, the fever, the shortness of breath. And there's a couple new ones that didn't make it on this list, and that is a recent loss of taste or smell. So I want to add that to the list as well. We've added those recently by the CDC. Let's take a look at how COVID-19 compares with other pathogens that we've had in our environment in the past. So you can see here, the most estimates put this new virus fatality rate just below 2%, with the transmission, which I'm going to talk a little bit more about, between 1.5 and 3.5. So you can see where it stands as compared to others that are more deadly. So Ebola, bird flu, smallpox, SARS are shown to be more deadly. And of course, the Spanish flu that happened in 1918 is also causing more deaths than the coronavirus. But as you know, we're seeing that those death rates come up every day in the United States. I want to talk a little bit of transmission. This is a little technical, but I think it's important to understand, especially as we're going back out and kind of doing that next phase of opening. And I want to talk about respiratory droplets, because that's really how this disease is spread, is through respiratory droplets. And there's a spectrum of how respiratory droplets are out in the air. So there's normal breathing. So just as I'm doing right now, I'm just breathing normally, I'm talking normally. In that case, there's not a lot of respiratory droplets coming out of my mouth or anyone's mouth. However, heavy breathing, the more heavy we breathe, that's when we're running or exercising, talking loudly, yelling, then the more air is coming through our lungs, coming through our trachea and out into the environment. And of course, then singing and coughing and sneezing are at the other end of the spectrum. So they do cause many more droplets to come out into the air that can then be spread and inhaled by someone else. So the RO I'd like to talk about is that it stands for, the way you say it technically is R naught. It is a technical term in medicine that we refer to as sort of the infectivity factor. And that is what we've studied in COVID-19, is that if I'm infected and I go out into the world and I'm around other people, spreading my respiratory droplets through these methods, because I'm sick, I'm probably coughing, we'll talk more about some other cases where we know singing has certainly spread as well, is I can infect up to 1 to 2 people, okay? And in some instances more. So that's why it is so important that we have social distancing, that if I'm ill and you're not close to me where you can inhale my respiratory droplets, then in that 6 feet distance is so important, so that you're not inhaling those droplets and then becoming sick with the virus. And that's why that's what we have to use right now to mitigate the spread. There's another factor called the K factor, which is the cluster factor, we call it. You may have heard it called the K-means is another term that they use in the literature, and that's 0.1 to 0.25. And that has to do with the time of exposure. So people who are clustered together over a period of time. So an example of that is actually the time of exposure that occurred in that choir. You may have heard this early on. This happened in the March timeframe in Washington State, where we had one person who at the time didn't know they were sick with COVID. They thought they had the common cold, and you could see why that might have happened. They infected 53 people, that one person who was sick, out of the 61 who were there at choir practice. They were there for 2.5 hours. They were singing, they were eating off the same plates in a potluck kind of situation. Then they went back to singing. And so there was a long period of time of exposure using singing. And then the viral load is also important. You've heard about the Japanese nightclubs. Again, 80 people were infected in one Japanese nightclub by a sick individual. And that's, again, that clustering of people coming together who one person could, with the disease, who's exhaling or aerosolizing, using these methods of coughing or sneezing or talking loudly, because they're all cramped together in a small space, that's when this can happen. And then, of course, there is some asymptomatic transmission is possible. So I just talked about people who were sick. They went to crowded places and they were sick and they infected other people. There are people who have the virus, we know this to be fact, who do not have symptoms. That's why testing is so important. That is why we're testing more and more to determine who may be carriers of the virus and to ensure that those carriers are kept quarantined for a certain period of time until the virus is dead, which is up usually around the 14-day period. Now, I think the role of masking is important for us to discuss because it's really protecting others from you. So think about the mask that you wear to the store or wherever you're going out to be among others. You're wearing a mask so that your droplets stay inside the mask and aren't sprayed out so that others inhale them. So masks don't necessarily protect you from others, but they protect you from spreading to others. So I want to make sure you understood that distinction. I want to talk about kind of the numbers. We're in healthcare, we're sort of into the numbers, that's for sure. And so you can see the most recent numbers that we have here in Santa Clara County. They're still going up. I look at them every day, sometimes more than once a day. We're at over 2,800 now with 143 deaths. In California, we have 15,000 with 4,286 deaths. And we now, in the US, are up to 1.8, and we do have the most cases in all the world and across all countries. You can see we do have a lot of people who've recovered, but we did pass that number of 100,000. And in fact, we now have 107,000 deaths due to COVID-19 in the United States. And of course, worldwide, we've now had 6.4 million confirmed cases with 2.7 million recovered and 380,000 deaths due to COVID-19. So this is, I thought, very interesting. In just a 2-month period, and this is just the United States data, we all know that heart disease and cancer cause the most deaths in the United States. That's been the case for a number of years. But take a look now at, over the last 2 months, what we're showing in regard to COVID-19 and the deaths that has been caused by COVID-19. Now, the third leading cause of death. There's some discrepancies between death certificates and state reports because death certificates tend to lag the state reports. We at El Camino report to the state every day. So that number is probably pretty accurate. The death certificates lag. Look at that then, chronic lung disease, stroke, diabetes. Now we know that some of those things contribute to people dying from COVID-19 if you have those comorbid conditions. So let's look at California by the numbers again. You can see the total number of cases here. This is just very recent from the 2nd of June. And you can see here that the ages are the most vulnerable age, which makes me just a little bit nervous because I fit this age bracket, is 50 to 64. Although, you know, obviously people over 65 are also high at risk. And then we do know that the gender of the confirmed cases, there are more males who have been infected than females. There's some where we are missing that data. And look at the hospitalizations. Here you can see how many have been confirmed as being hospitalized and how many are suspected COVID-19, and then how many fatalities we've had. Now this is predictive graph of where we could possibly be using the Washington Institute for Health Metrics and Evaluation. That's a tool that's been relied upon to do some prediction over time. And so you're seeing here the daily deaths that are predicted to occur in California. You can see kind of the dotted line that's vertical. Behind it are the daily deaths we've seen. Daily deaths projected are with the dotted line going forward. Sorry, it's the solid line backward from the vertical dotted line. And then the dotted line going forward are those projected deaths. We do see another little bump in projected deaths here in California. They do feel like this data has been accurate so far. And then here is, again, some data from that same area showing projected out to August. Skip through that. So here's an interesting factor, and that is the cumulative deaths by gender. And this is just Santa Clara County. So now we're getting away from California and getting closer to home. So females have died less than males. 40% of the deaths in Santa Clara County are female and 60% are male. There's been a lot of studying going on about why this is the case. You can see, again, those ages for the Santa Clara County population. That's a little bit older population than what you saw in the state. So in Santa Clara County, the 71 to 80-year-olds are those who are actually at the highest risk of death and are dying more. The males, there is some interesting evidence that's showing, well, men have more comorbid conditions in regard to cardiovascular disease, which is definitely a precursor and puts you at much higher risk for developing COVID-19 diabetes. The other feeling is that, although I don't think there's true proof of this yet, but we do know in some studies that the female having the Y chromosome versus the two, or the male having the Y chromosome versus the female having the two X's does affect immunity. So I'll just put that out there. Don't have a lot of for sure evidence on that, but there is some talk about that. Deaths by presence of underlying health conditions. So we see this here. No surprise that people who have died are certainly more, have more comorbid underlying conditions, is what we call it. And that is diabetes, cardiovascular disease, high blood pressure are all contributing factors. And those who typically have those diseases are typically obese as well. So that's what we're seeing. And then deaths by day for long-term care facilities and non-long-term care facilities. So this is a real concern for us at the hospital, is the long-term care facilities. So the nursing homes, where patients are typically in rooms together. They may eat in a congregate setting. So we have seen some hotspots around the county where certain skilled nursing facilities have had outbreaks. We're watching that very closely. We've actually received some of those patients at El Camino. And so it's very important that we're paying very close attention, testing those patients, testing those healthcare workers in those settings. This is the dashboard that you see in the Santa Clara County COVID-19 cases. This is from the Public Health Department. I've just gone over several of these areas of the dashboard in a more detailed way, but I did want to show you this because I think it's a really helpful thing to look at every day. So the thing that I draw my eye to when I look at this daily is I look at the new cases. I do have to say 17 is a lower number. When we were in the middle of really having the surge with the pandemic in March, April timeframe, you know, we were seeing a lot higher numbers. like 50 or more in that new case count. So I'm happy to see that that number is down a bit. So here we are, closer to home, and we look at both Mountain View and Los Altos and the number of cases that have been reported. And you can see in Mountain View, we've had 57 cases reported out of a population of 80,993. And then right here in our town of Los Altos, we've had 23 cases, and our population is a lot less of 30,588. So I thought that would be interesting. And of course, one thing to know is that San Jose has had the largest number of cases. It is the largest city in our county, and one might say that, you know, people are clustered together a little more because it is a more dense population in that area. So they did have 1,732 cases, and again, over that 1 million population. So important to note there that that's where we've had the most cases, in case you didn't realize that. So let's talk about El Camino Hospital, your local hospital, and what our situation has been. So important to note is that we had our first case community acquired. You may have heard on the news. At that time, we thought we were the first in Santa Clara County to have a patient who had community acquired COVID-19 that hadn't traveled to China. There was no history of travel. It turns out, we know now, that there probably was deaths related and other people with COVID-19 before the state. You've probably heard that a few weeks ago, where they did the tissue samples and at the coroner's office, at the medical examiner. And so we didn't really have the first patient, but we thought we did at the time. And so that happened way back in February. You can see how many patients on the left, the number of confirmed COVID-19 patients we had on any given day from February, March, and then all the way through April and May. So the most patients we had was 11. Now you have to understand that we had a lot of patients at any given time in March and April, up to probably 39 of patients that we were waiting for the test results back on. This was when testing was not nearly as available as it is now. But at any given time, 11 was our highest number. And you can look to the far right then of the graph, and you can see that we've gone, in the month of May, we went many days without any cases. We had one case for about a week, and then we went back to 0 for a couple of days, and then we have one case again. So very low numbers at El Camino. Very happy that Santa Clara County has, and our local community has really been mitigating the spread of COVID-19. We are not overwhelmed here. In fact, we're welcoming people to come get their health care. We want people to come back and get the health care they need, get the procedures they need. We're ready. We have excellent processes in place to make sure people are safe. So let's talk about testing, because this is a very important factor and something that we need to continue to work on in our country and in our state. Total patients qualifying for testing at El Camino has been 3,067. This was as of May 18th. Now, some patients come to our emergency department and they've been ill, having flu-like symptoms or COVID-like symptoms, and we have tested them, but they weren't sick enough to be hospitalized. And so we send them home. It's better actually to self-quarantine and not be in the hospital if you can, and if your symptoms aren't too severe. So we have had, in all of those patients that we've tested who've been symptomatic, 128 positive, both on the inpatient side and those who have left the hospital or were in our clinics. So that's a 4.1% positive rate. We've had, remember, at any given time at the highest peak, we had 11 positive patients. We've had a total of this whole time frame 45 patients in total in the hospital who were COVID-19. And then those who were outpatients, we had 83. We have had 7 deaths, and that's out of our 128, and so that's a 5.4% mortality rate. So our denominator is pretty low compared to some other organizations, but the community mortality rate is 0.2 to 0.3 because some other hospitals in our region have had many more COVID positive patients, particularly down in San Jose, than we've had here. So let's talk about how we test. I think it's confusing but important to understand. At El Camino, we use what's called a PCR test, polymerase test for RNA. It identifies the viral particles. It's very sensitive and accurate, and that's important to ensure that you're getting the right result. So someone who is positive is being treated properly. Now, there's a lot of talk about the antibody test. There is a lot of information out in the literature that the accuracy is variable. It does confirm the history if you had COVID-19, confirms if you had the infection. If the test is accurate, it doesn't confirm your immunity. We don't know that yet. If you've had it once, can you get it again? There's a lot of feelings that you can get it again. There's some evidence of that. So that's, again, something we don't know. And it doesn't not determine your infectivity. It's currently useful for really epidemiology and research purposes, like how many people in our community have had it. There's over 200 tests available for antibody testing. Now, I just heard the FDA took some of those tests off the market because they were not accurate. There are 12 tests currently approved, and some may have been removed. Also, I think it's important to note that you're generally positive on the PCR test, the test for the virus, 10 to 20 days post-symptoms. So the virus particles are still in your body at that point. So we're opening a little more. We're excited about this because you know, the sheltering in place has been difficult. And I just want to make sure that we are careful. We know what's already open. I like this particular page. It's on the Santa Clara County website. You might want to take a look at it. It talks about what's already opened, I should say, and by the type of business it is, and then what's going to be allowed to open starting June 5th. So the outdoor dining at restaurants, and hopefully Los Altos is putting together a plan. I don't know that for sure, but it would be great, and I'm sure for the restaurant owners, if we can figure that out, that would be very, very helpful to them and to people who want to dine in their establishments. Of course, the in-store shopping at retail, as long as we're having all those methods in place to be able to attain the social distancing, the manufacturing, the house cleaning services, and then, of course, the low, no contact services, and the pet grooming and dog walking. And then the child care, the summer camps, as long as they keep the groups up to 12 children so they can keep the children apart. And then they're changing the group every 3 weeks. And then also the outdoor ceremonies and the religious gatherings and outdoor recreation. So the small gatherings, no more than 25, against that cluster factor. All outdoor recreations that don't involve physical contact, as long as we're able to social distance, hiking, tennis, frisbee, golf, swimming, camping, drive-in theaters, and automobile-based gatherings. So that's the next phase. Then, of course, we'll be looking very closely. And you can bet Sarah Cody in the Public Health Department, our director, Health Department director, will be looking very closely at our numbers as we open up. So how do we prevent, and I've talked about this all along, is of course avoid contact with people who have symptoms. And of course, you want to avoid touching your eyes, nose, and mouth. And this one I can't even say enough, and I say it to my kids all the time who are teenagers, which you can't say it enough times and they just shrug you off anyway. But wash your hands frequently. 20 seconds is the best. And then of course, if you have gel in your purse, after you've been out in establishment, before you go in, after you're in, that's really great. Maintain your social distancing, and when you can, stay home too. The universal masking is something we do at the hospital. We all wear masks when we're here, except for when we're in our offices. We are allowed to take them off. There is some risk, as I said, of asymptomatic carriers, and that's why the social distancing remains to be important. People do think wearing gloves somehow provides them protection. What that does, actually, if you're wearing gloves for a long period of time, you're actually picking up potential particles and spreading them around. So the role of gloves should be worn for just a short amount of time and not for a continuous amount of time because of the reasons I just explained. And then, of course, in the businesses, it's very important to, of course, maintain a disinfected environment and using good disinfections and doing that frequently. And then, of course, protecting the workers in our environment. Here at the healthcare workers, we're using protective equipment constantly to protect our workers from people who may have an infection. But in your case, you may not know if your customers have an infection. So it's important to protect our workers from the customers and the environment. And then we want to also make sure the customers are protected from our employees and the environment as well. And there, you as business owners, I'm sure, have gotten other information from the County Public Health Department about some of the regulatory requirements. There's a lot of them, actually, and so it's very important to pay attention to those and read those carefully and really think about your processes and your workflows in your organizations and your businesses. So a couple more things about disinfecting surfaces and creating barriers for separation is important. And then monitor the symptoms and check temperature is an important countermeasure for your employees. Consider testing options like the PCR versus the antibodies. So here at El Camino, every morning or at the beginning of every shift, we check our temperature and we have to note our symptoms just to make sure that we're all safe to work here. And anything over 100 is reported, and that person has to go home if they have a temperature over 100. So also is for our customers is the universal masking. It is a protection from for others from the person wearing the mask. And then, of course, there is some legislation that's been introduced in Congress. I don't think anything is passed, but it is kind of interesting that, you know, there is concern of businesses who may be liable if someone actually has transmitted COVID in their environment, in their business, if they believe they got it there. And so there is some talk about some legislative, some immunity that could be passed through the Congress to give a little bit of ease to that liability to our businesses. Don't know if that'll pass or not. It is out there. So as the shelter in place relax, you saw there's a high likelihood that we're going to see more cases. And it's learning to, staying at home is just not something we can do forever. So we have to learn how to do business with COVID-19 in our environment. We know that the vaccine is up to 1 to 2 years away, hopefully sooner. We read about it, we hear about it in the media, but we don't know for sure. We're still in the clinical testing phase. So learning to social distance, mask, something that's going to need to be, as we talk about often, our new normal to keep ourselves, our families, our community safe. And of course, identifying, doing the contact tracing. So if someone does test positive, who were they near? So we can test those people as well. And of course, the sequestration. They're just necessary to maintain control without keeping the shelter-in-place order in place. So very important to keep that in mind as well. So a final thought here from Francis Bacon is if we begin, if we begin with certainties, we shall end in doubt. But if we begin with doubts and are patient with them, we shall end in certainties. So there's been a lot of uncertainties during this crisis, during this pandemic. And so we're learning more and more. One thing's for certain, it's going to be here for a while. We need to learn how to live with COVID-19 in our environment. And so that's something that we're just going to need to learn to do. Teach our kids. Hand washing is good for everybody. So if anything, that's the one thing that will help us not only spread COVID-19, but many other infectious diseases. So that's the end of my presentation.
Great, thank you so much. And so I put in the chat area that if anyone has any questions, we can go ahead and unmute you. You can turn on your video and you can ask your questions. I did have one while I was listening to the presentation. You talked about that gloves are really only effective for a short amount of time. Is going to the grocery store considered a short amount of time? What is a short amount of time?
So I would say what you don't want to do is touch things and then touch other things, many other things. You're picking up potential droplets, germs on your gloves, and then you're going around and touching other things with your gloves. Mm-hmm. So it's just something to keep in mind. So at the grocery store, for the few minutes that you're there, it's probably fine. Wearing them for up to an hour or two is not necessary.
Yeah.
As long as you're using good hand washing and cleansing.
All right, it looks like Shannon has a couple of questions. Let me go ahead and see if I can ask her to start her video.
Can you hear me?
Yeah, we can hear you.
Oh, okay. I'm not video ready.
Got it.
Okay, so hi, I'm Shannon. I'm with the Village Association. I have two questions. I can ask you both, and then you can answer, or I could ask one, and then whatever. You let me know what works for you. So some of our merchants have shown have concerns as far as contact transmission about keeping merchandise quote sterile. And I know that the information keeps changing all the time about how transmissible the virus is on surfaces. And I'm wondering if you have any advice for merchants who have, merchandise, whether it's clothing or more of like a hard object, like a picture frame or something in their store, and they don't know, do I need to follow people around and, wipe things down after they touch them, or how worried do they need to be about that without losing their minds? Do you want to answer that? And then I can ask my second question, maybe?
That's such a good question. And you're exactly right. We don't actually know how long the virus lives on surfaces. We know it lives on surfaces for certain periods of time where there's still a lot of study happening in that area. What I would say to merchants is that I wouldn't go crazy about following people around and wiping things down. I think that it's good to have a routine to disinfect things multiple times during the time that they're open, but not overly frequently, I would say, would be the case, particularly for hard objects where people are touching them. And that could potentially cause transmission. Again, not knowing how long things live on the hard surfaces.
So maybe like the high contact areas, like near the cash wrap and like anything that multiple people would be touching, that would probably be easy to implement a routine for disinfecting that, at least that particular area of the store.
That's the most important area, right?
Yeah.
Because that does have the highest touch point.
Yeah. Okay. Okay. And then the other question I have is about temperature taking. How reliable is temperature taking as far as, well, I guess the question is, can someone be contagious? So like maybe be an asymptomatic person with the virus, but having no symptoms. Well, I guess a symptom is a fever, right? So can you basically have a normal temperature and still transmit the virus?
Yes.
So temperature taking is something that's done because it'll catch some of the people, but it's not like obviously 100% reliable to catch everyone who is potentially contagious.
That's true. The asymptomatic people were not, we know that they can carry the virus to others, and they wouldn't have a fever necessarily, so it's important to know that checking a temperature is one method of mitigation, but certainly that's why it's so important to social distance and to cleanse our environments, because you're right, we don't necessarily know who may be carriers.
Okay, thank you so much.
And we had one follow-up question about the gloves answer. So so you're saying when you use gloves and you're touching items, you're spreading the droplets potentially to other items. Is it more susceptible to spread when you're using gloves versus bare hands, or is it essentially the same thing?
The gloves don't help, is what I'm saying. People think that it's helping from spreading. It's not. Your hands can spread, your gloves can spread. So it's not necessarily helping from spreading the virus around. And I think that's what people think is the case, but it's not.
Okay. All right. Looks like Shelly, you have a question. You okay if I unmute you and you can answer that one yourself?
Oh, sure. I was just thinking about what's been in the news, not lately, but recently. Can a merchant not allow someone into their store if they're not wearing a mask? Because we're talking about, legal liabilities and things like that.
So there is a universal masking order right now. So if you go to Safeway and other places, you'll see they have a sign there, and they have someone at the door. They're not letting people come in if you're not wearing a mask. So the hard one is at restaurants, right? Because you can't eat very easily with a mask on. So that's why in those environments, people are going to have to not have masks on while they eat. And the social distance is even more important. And also the outdoor environment, because obviously we can spread out a lot more. The air is more able to be flowing in an outdoor environment rather than in an indoor environment where air is recirculated. So thus the reason for the social distancing in those areas. But again, it's harder in indoor to keep the social distance, right? If you're in a confined space, thus the mask.
So looks like Mimi has a couple of questions. Mimi, do you want to go ahead and unmute yourself?
Can you see me or can you hear me okay?
Yes.
Hi there.
Hi.
Hi. My question is, I just recently learned about a mail order COVID home testing. And I'm wondering, I'm a small business owner of a Curves for Women. So we're a small boutique gym, and I'm wondering if I should purchase this home testing kit for me and my employees. Would you recommend that?
I would recommend you use the free Santa Clara County testing site. Versus, I don't think the home testing is, while it's available, I would go with the sure thing.
Okay.
And those tests, I can say, are done expertly. They are performed by someone else who knows how to do the test. And I would just recommend you go that route for you and your employees.
Okay. Thank you. And then my next question is just a follow-up from the earlier conversation about the face mask. You know, there are people, we're starting to hear stories about customers coming to the store with the face mask, but once they go into the Costco, they remove it. So then as a business owner, you know, what do you do in that situation? I'm having to kind of role play and anticipate whether argumentative customers or members who don't want to wear a face mask during their workout. I'm trying to anticipate what those issues are and how to respond, you know, carefully, professionally, but still keep everybody's safety in mind. So how would you respond to that?
Well, first, I think, of course, you'd want to make sure it was very clearly communicated on your website, on signage on your front door, so that there's no question about what the rules are. Right? Yeah. And then if people are in your business and they remove the mask, I think politely asking them for everyone's safety, we need you to wear a mask. And I think you ask once, and then you know, I think then you have to decide if the person refuses what your rule's going to be, which may mean that, I'm sorry, but right now I can't take any chances. I want everyone to be healthy and be able to exercise in a healthy environment. And so until you feel like you can wear a mask, why we still have to do this, you're not going to be able to exercise with us or something like that.
Which is true. The pushback I get is, and it's not common. It's just like the one or two that causes stress. You know, like that conflict. They're argumentative, but they're saying that there are some people who can't wear a mask. They're claustrophobic. These are the things that I've heard recently. They're claustrophobic. They have asthma. They have allergies. And part of me is, my response is that perhaps we need to find a mask that works for them, where they're not going to feel claustrophobic. Or number two, if they have allergies, probably the face mask would help.
I've heard that, actually. Yes, I've heard that people with severe allergies, they're feeling better than ever wearing a mask, and so that's so true. And I think exploring those kinds of options with your customer is really a great approach, where, gosh, there's this other type of mask, have you tried that? I think that's friendly and a great approach to try that.
Thank you.
Thank you, Mimi.
I had one follow-up question on that, Cheryl. I'm Kim Mosley, president of the Chamber. Thank you so much for presenting to our members today. I really, really appreciate the insight and information that you're sharing with everyone. It's so helpful. Just to follow up on what Mimi had asked with the testing, if you are a small business here in our community that will now have contact, like a retailer, restaurant, contact with the public on a daily basis, what is the schedule that you recommend for going to be tested? Like how often?
So healthcare workers, the state is recommending, and we're high risk, is every 30 days. For those who work in skilled nursing facilities, the state is recommending every 14 days, because that population is even more at risk. But with your normal healthy population that's able to get out of their home. Obviously the skilled nursing facility patients, they're not a normal healthy population, but those coming into your businesses, I would say the every 30-day rule is sufficient.
Okay.
So next we had a question from Cameron. Cameron, do you want to go ahead and unmute yourself?
Yes. What my question comes down to is on the personal side. So if you've got someone at home that has a high-risk situation, I happen to have a compromised immune system. And as my husband goes back to work and he comes home, or like my staff that has to go home to their families, is there a suggested protocol that you follow when you enter the home again?
I think, again, the good hand hygiene is most important for the person who's been outside the home, coming back to the home. That's the first thing that needs to happen. Some people feel more comfortable taking a shower. Some people feel more comfortable also putting on new clothes, fresh clothes after they've been out, if they're coming back to a loved one that may have, you know, a compromised immune system. And I would say that those are good practices to keep in mind for those who may be compromised, for those loved ones coming back into the environment.
Great, thank you very much.
And we have another question from, I'm sorry, Kim. You want to go ahead and unmute yourself?
It's Tanya. Good morning, and thank you very much for doing this for us. I am on the call representing Bar 3, which is a workout studio. And my question is, of course, we'll be reducing the number of clients who can enter the studio when it is able to reopen, so maybe 10. Is it recommended that we check clients' temperatures, or is that going overboard?
You can do that.
Is it appropriate to do that?
I would do that.
Okay.
Yeah, and get the little thermometer that, you know, has the little infrared on it.
Okay.
People are doing that going into retail settings. I have to tell you, I went to Sports Basement last weekend in Redwood City. I walked in the door, and that's the first thing they did.
Okay.
It is part of our new normal now.
Okay.
We're going to need to expect this. And I would want this for, you know, if I'm exercising in your place, I want to know everyone around me doesn't have a fever.
Yep, I agree. Okay.
Mm-hmm. It's okay.
Okay. Thank you very much.
I think your point earlier, Cheryl, of just deciding your policy and communicating that well, especially, you know, fitness is not open yet. So you have a little bit of time to really decide what your policy is and communicate that in anticipation of opening, and just make it aware that this is.
Yeah. Here at the hospital, we opened up to visitors this week. We hadn't allowed visitors until this week. And every visitor that comes in, we take their temperature and we ask them about their symptoms. Do they have cough, shortness of breath, and new loss of taste or smell? So we're asking everyone who enters and all of the staff. And obviously we're in an environment where we want a healthy environment here for people who are ill.
The threshold, Cheryl, is 100 degrees. So if you have a temperature of 100 degrees or higher, then you're not allowed to enter.
That's correct.
May I ask a follow-up question about the temperature? When we are putting out our recommendations or how we are going to be moving forward, I feel like it would help if we include some of what you were talking about, Cheryl, with the respiratory droplets and where we are on that spectrum.
Mm-hmm.
could that, I think that might be, I mean, there's certainly heavy breathing,
Yeah.
talking loudly. So I think keeping in mind, again, that we presented at the beginning, and this is why I think perhaps that may make people more, or may acquiesce more easily to having their temperature checked.
Yeah.
Okay.
Yeah, it is important. Yeah, I think it is. You know, it's on, you can look at the CDC website. They have a ton of great information on there. And that's, it would give you that kind of that spectrum of aerosolization is what it's called, how our droplets are aerosolized. So you may want to go there. And it's always, I find it, when I can say, hey, here's what the experts are saying,
Yes.
you can rely on that. And people listen typically.
Yes.
Yeah.
Okay, thank you.
And we will have this recording available later on our website, and maybe Cheryl, if it's okay with you, I can also share the link to the presentation. I can provide those slides, so maybe that'll be something easy to screenshot and use.
Sure.
But I'm sure, you know, go to change. There's a lot of changes in the data every day, so CDC websites are, you know, probably your first place to go, but we can provide that as well.
Yes, it's those are definitely saved as my favorites on my on my phone and my desktop. So
yeah. So I think Amy, you had one more question. Yeah, let me unmute you, or there you go.
I think the scariest situation is that being a small gym is that what happens if one of your customers contracts COVID-19 and then your staff are, you know, your staff are exposed. So do we close for 14-day quarantine?
Yeah, you would be advised by the county. So the county knows every positive person, right? County Health, Public Health Department. They do contact tracing at the County Health Department, and they determine, they would be in touch with you about how long, there's many questions that they investigate. How long was that person there? Were they wearing a mask? Who did they have contact with? How close in proximity for how long? There's lots of questions. And so then they would be the ones to help you decide the most appropriate approach.
Right. So the important thing is that we would be contacted by the county. And because, you know, until a vaccine is found, then we're anticipating the fall second wave or third wave. And so these are the questions that I have that keep me up at night. So
I'm sure they are.
Yeah. So thank you.
I can appreciate that, Mimi.
All right, so we're right at 11 o'clock here, so we'll let everybody get back to work. And thank you so much again, Cheryl, for joining us, and thank you everyone for participating with your great questions.
It was really a pleasure, and thank you for all you're doing. I know these last months have been trying for all of us, so hang in there.
Thank you, Cheryl.
All right.
That's all we can do.
Yeah. All right. Thank you, everyone.
Thank you. Take care.